Both public and private health facilities operating in Lagos State have been urged to stop the trend of rejecting gunshot victims. Some stakeholders gave the charge during an interactive session on the compulsory treatment and care for victims of gun violence and road accidents in Nigeria. Chairman of Nigerian Bar Association Ikeja and Ikorodu branch, Dele Oloke, and Bayo Akinlade, and the NMA chairman, Dr. Saliu Oseni, stated that some tricky issues need to be sorted out as it hinders doctors from carrying out their functions according to the Gunshot Act of 2017.
For me, it's a holistic piece of legislation, and we want to advise all the stakeholders mentioned in that bill to see that they ensure compliance with it, because it's going to be in the overall interest of the United States of Nigerians. That bill exists all over the world, and it has worked in those countries. Every professional must be community relevant. And one of the ways we can be community relevant is to offer services.
The law should be more doctor-friendly. We should encourage the doctor with the law and perhaps reward hospitals and doctors who effectively and immediately treat victims of gunshot wounds. Because if you reward them rather than sanctioning them for not doing it, they're more likely to do the job. For example, if you say if a doctor receives a victim and he successfully treats that victim within a given period, then that hospital or that doctor may be rewarded for maybe by monetary compensation, or maybe giving a certificate of...
People should also know that sometimes the life of the doctors are at risk. The issue of reporting the case to police within 2 hours is not feasible. It's just like saying that you must attend to every patient within 5 minutes. It's practically impossible, because when a patient comes in, somebody will take vital signs, somebody will interview the patient, as a layman would say, will take history. You understand? Then you make a diagnosis before you can start treatment. So it's not just you bring a patient in, just like we had in the air, and somebody will say, oh, my patient, my husband needs oxygen. When a patient is bleeding, it is not oxygen that is the treatment. You can even operate a major patient without oxygen.
The program advisor, Blessing Abiri, and other stakeholders called for proper sensitization programs by government at all levels, where citizens are informed of their various rights and obligations under the Act.
We believe that with this startup advocacy, we would, build the momentum to take it nationwide, so that we talk about it nationally, so that key agencies begin to key into it. Because people don't know, and if the hospitals and the police and various agencies, law, road safety, all NSCDs, all of them involved are not aware, then we still are where we are.
I think we have to begin discussions within stakeholders at all corners. First of all, Nigerian Medical Association are very, very key in this. Nigerian police are all over the country, but the mass media is everything. With the era of social media, we can talk about this. Like you said, Lagos is much aware. Outside Lagos, they don't even know that there's an act like that.